opportunities, failures and neglect by authorities are coroner's concerns after the deaths of 6 teenagers.
There are systemic issues with mental health services. If you look at the funding, very little funding is going into mental health services.
The latest in the migrant crisis. Hello, the senior coroner for West Sussex has raised serious concerns about the funding of children's services after 6 teenagers took their own lives last summer. Penelope Schofield was speaking at the inquest into the death of 14-year-old Mason Clark. She detailed a number of missed opportunities to share key information and give Mason the treatment he needed. Other inquests into the deaths of these teenagers have revealed a catalogue of missed opportunities, failures and neglect by authorities. Mason's mother is calling on the government to carry out an urgent review of support available to young people. Lucinda Adam has been looking into this and a warning that you may find some of the details upsetting.
Mason Clark was a child who loved the outdoors, had a passion for carpentry and loved gaming. But when childhood traumas meant he suffered with his mental health from the age of 8, his mum Jess struggled to get help from the services available. Mason took his own life last September.
Initially it was because of his age, and then later on I'd speak to the GP, and there were thresholds. So to access the next level of mental health services, there are certain thresholds that you have to meet, and Mason wasn't meeting those thresholds. Even if he had met the threshold, there were 9-month plus waiting lists at that point. So we looked at alternative options. So there were other local services we tried to tap into. Some of them we spoke to, were told we'd get a service, but nothing came out of that.
The senior coroner for West Sussex agreed there had been a number of missed opportunities to share information between Mason's school, his GP, counsellors, police and council and NHS services. Penelope Schofield added, "The issue of funding is a concern for me. I'm aware services in West Sussex are overwhelmed. There are attempts to utilise resources, but there are still gaps, long waiting lists that are not acceptable. There's a lack of counselling in school holidays and insufficient counsellors in schools."
I wish West Sussex was an unusual example, but sadly we've seen it all over the country. There are systemic issues with mental health services. If you look at the funding, very little funding is going into mental health services if you compare that to physical conditions, yet the rate of people with mental health issues are increasing.
Between May and September last year, 6 teenagers took their own lives in West Sussex. Mason, Kaylee Taylor and Robin Skilton were just 14. Marcy Walton was 16. Marcus O'Neill and another boy were both 17.
The access to appropriate and suitable mental health care provision have time and time again been inflicted by the same problems. A failure to communicate between the agencies, and that those children and young people have been unable to access those services which quite potentially may have saved a number of lives.
Over the past decade, suicides among adults have risen by 14%. But among young people and children, while still relatively low, numbers have risen steeply by 74%. Out of those, suicides among 10 to 14-year-olds are rising fastest of all. They've more than doubled. At 16, Alex Wilkie started a blog to help young people in Sussex talk about their worries. During the pandemic especially, she says it was teenagers who were left trying to comfort their friends in crisis.
It got to that point where they were just trying to use their friends as sort of therapists, I guess, and that can take quite a big toll on that other person's mental health, especially because they're kind of harbouring all of the stuff that their friends have been telling them, but also struggles that they have themselves.
These mums in Horsham set up a support group for parents concerned about their children.
Within 48 hours, we'd had 1,500 people sign up to the Facebook group, and it went mad.
It was just, they needed help there and then. And, you know, we were having counsellors and trying to send them, you know, their numbers, and it was like, well, we can't wait 18 months. We need this now. Our children are suffering now.
I think unless you as a parent, unless you scream really loudly, or unless your child ends up in hospital, there are children going through the cracks, and that's the sad thing, and I don't think it's going to stop.
None of these toys are leased to. Jade Hutchins took his own life in 2020. He was 18 and Child Services closed his case without any referrals to adult services. The coroner said that was a gross failure.
As long as your child turns 18, it doesn't mean they are adults. You know, being 18 is just like coming from, it's actually worst age, you know, from 18 onwards up to about 20. He said to me, Mom, everywhere you took me, nobody seems to be listening to me. You know, they don't do early help. Why is it that everything has to be worse before a child is referred? Why?
The coroner said she feels keeping funding for children's services constantly under review is her responsibility to the community of West Sussex.
And Lucinda is here. Lucinda, it's a desperate situation, isn't it?
It is, and the senior coroner has written to the Secretary of State for Health about this to express her concerns that the NHS Child and Adolescent Mental Health Service, which is known as CAMS, is experiencing an explosion in demand and putting lives at risk. Let's have a look at the figures, because referrals to CAMS have almost doubled since May 2019 to May 2022. Their duty caseload has more than doubled, from more than 2,000 cases to now more than 4,000 cases. And it means that CAMS are now dealing with an additional 500 young people, but with no additional resources or funding. Now, charities tell us that that is giving the worst possible message to young people.
The message that we're getting from children is we don't matter to adults. And that's awfully tragic, because most of those adults who are in the caring profession, certainly most mums and dads and nurses and doctors, want the best for the children in their care. But the message that we are unwittingly transmitting to children is you don't matter. So the waiting list, if you like, is a gap between you matter and you don't really matter.
Well, the government is required to respond to the coroner. So far, they've missed 2 deadlines to do that. Locally, the various services are working hard to try and support these young people. They've made significant changes to what they do since these deaths. CAMS now has a single point of referral, a phone number and an email, where young people are then triaged and signposted to the relevant services. They also now have a dedicated duty team to contact young people on waiting lists, and they're working on a drop-in hub. West Sussex County Council now has a transition programme to look at young people turning 18 to refer them to adult services. But the services need to communicate better with each other, but also better with young people. So parents said that the system feels antiquated in the digital age that their young people are living in.
Lucinda, thank you. And if you've been affected by the issues raised, you can get some advice from the BBC Action Line. That's bbc.co.uk/Action Line.